Today, we're diving into one of the most powerful tools doctors have in the fight against lung cancer, the PET scan. We're going to break down how it helps them see the completely unseen and what you can expect if you ever need one.
So think about this for a second. How can a doctor possibly see what's happening at a microscopic level deep inside your lungs without making a single cut? Honestly, it kind of sounds like something out of a sci-fi movie, but the answer is just incredibly clever science.
And the answer is a test called a Positron Emission Tomography scan, or as pretty much everyone calls it, a PET scan. It's this amazing, non-invasive way for doctors to get a window into what's happening biologically inside your body.
So, here's our game plan for this explainer. We're going to walk through the whole thing. First, we'll get into what a PET scan actually is. Then, how you get ready for one. After that, we'll cover what happens during the scan itself, how to make sense of the results, and finally, we'll talk about safety and the key things to remember.
Okay, so first up, what is a PET scan, really? Well, at its heart, it's a process that uses your body's own biology to literally create a picture of what's going on inside. So here's the official definition. It's an imaging test that uses a tiny bit of a radioactive tracer to see how your cells are using glucose, which is just a simple sugar. And this is the magic trick, right? Cancer cells are often super active, which means they gobble up way more sugar than most of your normal, healthy cells.
I love this analogy. Think of that tracer like a spotlight. It goes into your body, and because those cancer cells are so hungry for sugar, the spotlight is drawn right to them. It literally makes those cells light up on the scan, turning something totally invisible into something a doctor can clearly see.
So why would your doctor order one of these? Well, there are a few really key reasons. They might be trying to find out if cancer is there in the first place, or if there's already a diagnosis, they can see how far it might have spread. It's also a fantastic tool for checking if a treatment is actually working, and it can help them pinpoint the exact spot they need to target for a biopsy or radiation.
Okay, that brings us to the practical side of things. Let's talk about how you get ready for your scan. And the good news here is that it's actually a pretty simple, straightforward process. Now, your doctor will give you your exact instructions, but here's a pretty standard checklist. You'll usually need to skip food and drink for about 8 hours before the scan. It is so important to tell your team about every single medication or supplement you're taking, and of course, let them know if there's any chance you could be pregnant or if you're breastfeeding. On the day, you'll need to take off any metal, and don't forget your ID and insurance card.
Now, this next point is absolutely critical. If you have diabetes, you have to let your provider know. Remember, the whole test is based on how your body uses sugar. So if your blood sugar is high, it can really mess with the results and make them hard for the doctors to read correctly.
All right, you're all prepped and you've arrived for your appointment. Let's walk through what actually happens on the day of the scan, just so there are no surprises.
Here's a quick look at the timeline. First, that radioactive tracer we talked about is given to you through a simple IV in your arm. No big deal. Then, you'll just chill out and rest quietly for about half an hour to an hour. This is the absorption time. It just lets the tracer travel through your body and get soaked up by your cells. And then, the scan itself is usually pretty quick, maybe 20 to 30 minutes.
So, what's really going on during that scan? Let's break the science down into 4 easy steps. After the tracer is injected and absorbed by your body, it starts to give off these little energy signals called gamma rays. The PET scanner is basically a super sensitive gamma ray detector. As it picks up all those signals, it sends the data to a computer which then does the heavy lifting of putting it all together into a detailed 3D image of your body. Pretty cool, right?
So what does it actually feel like for you? Well, you'll be lying on a table that slides slowly into the machine, which looks like a big donut. The most important thing to know is that you are not alone in there. The technician is in the next room and they can see you, hear you, and talk to you through an intercom the entire time.
The scan is done. So what's next? This brings us to the big part, understanding what your results actually mean. It really all comes down to decoding those images the scanner created.
So what the computer builds is basically a map of your body that shows where that radioactive tracer ended up. Any areas that have a lot of the tracer, which suggests a lot of cellular activity, show up on the image as bright spots.
Your results will usually fall into one of 3 buckets. If those bright spots pop up in areas of concern, the result is considered positive. That usually means more tests or starting a treatment plan. A negative result is great news. It means no areas of high activity were found. And sometimes the result is inconclusive. That just means the pictures weren't quite clear enough to be sure, so your doctor will probably order some other tests to get a better look.
Now, you're not expected to read these images yourself. A specially trained doctor, a radiologist, analyzes everything. They write up a full report and send it to your doctor. You should then expect a call from your doctor with the results in about 1 to 3 days. Okay, last section. Let's talk about safety and then wrap up with the key takeaways. It's totally normal to have questions, especially when you hear the word radiation.
So, how long does that tracer actually stick around in your system? The answer is not long at all. It's designed to break down really fast. It's typically gone, just naturally flushed from your body, within about 2 to 10 hours.
So, the bottom line question, is it safe? Yes, PET scans are considered very safe. The amount of radiation you're exposed to is small, and as we just said, it leaves your body quickly. Here's a pro tip. Drinking lots of water after your scan can help flush it out even faster. Side effects are super rare, though you might have a little soreness at the IV spot.
It's also really important to remember that a PET scan is just one piece of the puzzle, right? It's a really powerful piece for sure, but it's almost always used alongside other tests like a CT scan or an MRI. Putting all that information together is what gives your doctors the clearest possible picture of your health.
So, we've walked through what a PET scan is, how to get ready, and what it all means. We'll leave you with a final thought to take with you. Now that you're prepared and you're informed, what's the most important question you are going to ask your doctor about your scan?